over the age of 18 and I consent to this video.
Knock, knock, knock. Perform hand hygiene. Hello, Mackenzie. My name is Sam. I'm going to be the nurse today performing your assessment, okay?
Okay.
Alright, so I'm just going to close this curtain to provide us some privacy. Before we begin, can you just tell me what your name and your date of birth is?
Mackenzie Carpet on September 30th, 1999.
Okay, Mackenzie. So, do you have any immediate concerns for me at the moment? Is there anything that you want to address specifically?
No.
Okay, great. So I'm just going to inspect the scene just to inspect for safety. I don't see any IVs, I don't see any drains, I don't see any tubing. There is no urinary catheter, there's no side rails, so the scene is safe. So do you have any pain right now on a scale of 1 to 10? 1 being no pain, 10 being the most pain you've ever felt in your entire life?
0. Oh, 1.
Okay, great. Alright, so what we're going to do first is I'm going to assess for your vital signs. So I would assess for your blood pressure by putting a blood pressure cuff right here on your arm. And then I would also assess for your temperature by putting a thermometer into your mouth. I would assess for your oxygen saturation levels by putting an SpO2 monitor on here on your finger. And then I would also assess for respirations by counting your respirations for 30 seconds and multiplying it by 2. Okay? Alright, so Mackenzie, can you tell me where we are right now?
The hospital.
Okay, and then can you tell me who the president is?
Joe White.
Can you tell me what year it is?
2021.
Okay, so the patient is alert and oriented times 3. So the first thing that we're going to do is we're going to assess for your respirations, okay? So I'm going to have you keep your mouth open, and then every time you feel my stethoscope, just take a deep breath, okay? All right. Okay, so mouth open and deep breath. 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 Okay, can you stick out your arms for me? Mouth open and deep breath. Mouth open and deep breath. Mouth open and deep breath. Okay. Mouth open and deep breath. Mouth open and deep breath. Mouth open and deep breath. Okay, so anteriorly I did not hear any signs of wheezing, any stridor, any abnormal breath sounds. I'm going to have you stand up and I'm going to assess you posteriorly. Then you could just turn around. Okay, so we're going to do the same thing, mouth open and deep breath, okay? And laterally. Okay, I'm going to have you take one more deep breath for me. One more deep breath? One more deep breath. Okay, what I'm assessing for is just to check to see if she's using her accessory muscles to breathe, which she is not. At this time, if we were in a patient setting, I would lift up the patient's shirt and just assess her posteriorly. So I would be looking for any signs of edema, any sores, any lesions, or any abnormalities, which I do not see. So you can go ahead and sit back down. Okay, so now I'm going to just be assessing for your heart sounds, okay? And then the apical pulse, and I'm going to listen to this for 60 seconds. So apical pulse was 72 beats per minute. I did not hear any abnormal heart sounds. I also didn't hear any wheezing or stridor or abnormal breath sounds posteriorly, okay? So everything sounds great. So what I'm going to do now is I'm just going to assess Perla. So this is just checking to make sure that your pupils are equal, round, reactive to light, and accommodation. So I'm just going to have you look forward. Okay. And then can you look at my pen light and look at the wall? Pen light, wall, pen light, wall. Okay. So pupils are equal, round, reactive to light, and accommodation. I'm also going to check your sclera for jaundice. Okay, so I don't see any jaundice. Can you open up your mouth for me? I'm going to inspect your oral mucosa just to make sure that I don't see any sores or any lesions in your mouth. Oral hygiene looks great. The oral mucosa is moist and pink, which is good. Okay, so now I'm going to have you lay down and I'm going to assess your abdomen. Do you have any pain or any tenderness in your abdomen? Okay. And when was the last time that you had a bowel movement?
Yesterday.
And was this normal for you?
Yes.
Perfect. And then when was the last time that you urinated?
Today.
Okay, great. Do you have any pain or anything in your abdomen?
No.
Okay. So in a normal patient setting, I would first inspect. I would just be assessing just to make sure that there's no edema present or any bulging. Now I'm going to also take your bowel sounds. I'm going to start with the right lower quadrant. Right upper. Left upper. And left lower. Okay, so there were active bowel sounds noted in all four quadrants. So now I'm just going to assess for pain or tenderness, so you just let me know if you feel any, okay? Pain or tenderness? Pain or tenderness? Pain or tenderness? Pain or tenderness? Okay, great. So you can stay laying down. So now I'm just going to assess your lower extremities. So what I'm looking for is any presence of edema. There's no presence of edema. I'll check your temperature. Temperature is warm and even throughout. The skin is not diaphoretic. So now I'm just going to assess your pedal pulses. Pedal pulses +2 and equal bilaterally. Okay, so I'm going to have you pull your feet up against my hands. Okay, so that's going to be dorsiflexion. Push your feet down against my hands. Great, so that's going to be plantar flexion. You can sit up. Okay, so now what I'm going to have you do is stick out your hands. Perfect. So what I'm assessing for here is just your capillary refill. Capillary refill is less than 2 seconds. And I'm also going to have you flip over your hands. And I'm going to assess your radial pulse. Your radial pulse is +2 and equal bilaterally. I would also assess your radial pulse, and to get your pulse rate, what I would do is I would just assess your radial pulse, and then I would for 60 seconds, okay? So I'm going to have you squeeze my fingers. Perfect. Can you push my fingers towards me? Pull my fingers towards you. Okay, great. All right, so you said there was no immediate concerns or anything. Is there any resources that you need or any additional education? Okay, so Mackenzie, the doctor should be in to see you shortly. I did already assess the scene for safety, so there's no tubes, no draining, there's no IVs, there's no catheter. The side rails are up, or the side rails are down. So the patient is not at any risk. The call light's going to be right here if you need anything, okay? All right, so the doctor should be in to see you shortly. Okay. Hand hygiene, and leave the room.